helping make your life easier. Moms Every Day.
Hey everybody, Hattie Cheek here with Moms Every Day. We have Dr. Nease with us from Cabell Huntington Hospital today. Good to see you again.
Good to see you.
Talking about bariatric surgery. So this is something that you perform frequently.
Yes.
First, explain what it is.
It is surgery that we do on the stomach in order to help someone lose weight by helping them eat less food and eat food in a different way. And then there's a lot of changes in one's metabolic activity that occurs as well. So that's what bariatric surgery is.
So it helps you to lose weight. When should someone actually consider this?
So when someone is 100 pounds or more over their ideal body weight, that is a time to consider it. If you're slightly less than that, say you're 75 to 100 pounds over your ideal body weight, and you have significant medical problems that are directly related to the obesity, that's also a time to consider weight loss surgery as an option for your obesity problem.
Obviously a very big decision that is not made overnight.
No, definitely not.
All right, and so when it comes down to it, are you required to do certain things before you're even eligible to get this surgery, like diet, try certain types of exercises?
Yes, all insurance companies require a certain period of time where patients go through a medically supervised weight loss program, which usually includes some type of exercise. As well, different surgeons may have different requirements in terms of some type of a diet for 2 to 4 weeks prior to surgery. And some people, because of their size, may have to lose a certain amount of weight just in order to be a safer candidate for surgery, so that things can be done in a safer manner.
All right, so sometimes you have to lose weight before you can really do the losing of the weight.
Correct.
Okay,
Correct.
And then you brought up insurance. So is it sometimes covered by insurance?
Most insurances cover it and cover one of the procedures that are out there. It is, however, on some programs, an exclusion on the policy. And so when it's an exclusion on the policy, then clearly it's not covered and patients have to pay for it out of pocket.
So that's more of something that you have to do, go through your paperwork to see if that's something that you qualify
Correct.
for, and
Correct.
perhaps have to change your insurance the next year around.
That's right.
All right, and then when it comes to getting this surgery and getting pregnant, interestingly, you brought it up and said a lot of people come to you and ask you when they can get pregnant after having this surgery. So then there is a large age range too of people who get this done.
Oh yes, anyone, from 18 years, on up. And there are some programs that do adolescents. So after weight loss surgery, most people are going to recommend 12 to 18 months before someone gets pregnant. And you want that pregnancy to be planned. So you want to plan that ahead of time, make sure that certain vitamins and minerals are adequate, and make sure that your nutrition levels are adequate in order to sustain that pregnancy.
So at least a year after your surgery?
At least a year.
What about, are people deciding to get pregnant before they get this surgery, or are they usually in that body state where that's not a smart idea either?
I think that just depends on the age of the individual, whether they've had kids or not. So there are some folks who have not been able to get pregnant because of their weight plays into that. So as one loses weight, they become more fertile due to insulin resistance and other things. So there are some people that are in that category, and there are other folks who have had a couple of kids and just aren't quite through with having additions to their family. And they may opt for weight loss surgery at that time with the intent of having kids later on.
And not saying that this would require bariatric surgery, but if you are considering getting pregnant and you're having a really hard time, you can always check to see if maybe your weight is a factor.
Absolutely.
And
Absolutely.
so the importance of eating healthy and making sure your exercise leading up to that kind of decision. And then when it goes for just the surgery in general, you're not making any plans afterwards, how long is the recovery time?
We tell folks to plan on taking 1 to 2 weeks off of surgery. Some folks can go back at a week to light activity or half days, but generally by a couple of weeks, individuals are able to go back at work without any issues.
And you've seen success stories. I'm guessing you've done this so many times.
Oh, absolutely. That's always a joy whenever you see someone later on after the weight's been off. And
How much weight has somebody lost? What's your biggest?
Oh gosh.
Your biggest loser?
Yeah, biggest loser. I don't know. Several hundred pounds.
Several hundred pounds.
Yeah, it depends on how much they weigh to begin with, right? So,
And they do have to keep up the work afterwards, I'm guessing.
oh, yes.
Yeah.
Yes.
All right. So if you need any more information, you just head to our website, WSAZ.com. Click on the Moms Everyday tab. You can rewatch the interview and get all the info that you need to know. Thanks for joining us today. We'll see you here later. Have a good one.